Retain Kentucky, Retaining Employment and Talent After Illness or Injury Network. Every year, millions of Americans leave the workforce due to injury or illness. Employees leaving jobs can face health challenges, financial problems, loss of health benefits, and a poorer quality of life. Employers face unexpected expenses due to the loss of a valuable employee. Governments at all levels face reductions in the tax base, costly payouts of disability benefits, and decreased economic activity. The whole process of getting back to work is complex for the worker, the employer, and the healthcare provider. Research has shown that individuals with non-occupational illnesses or injuries are at high risk of becoming unemployed. According to the Kentucky Chamber of Commerce's 20 Years in the Making Kentucky's Workforce Crisis report of 2021, Kentucky is 48th in labor force participation. The Society of Human Resource Management, or SHRM, reported in 2021 that employee turnover can cost an employer 6 to 9 months of a worker's salary. Workforce and healthcare systems are not designed to talk to each other. The medical system has been primarily designed as a communication pathway among patients and their providers. The information a healthcare provider receives on return to work options comes primarily from the patient. With all these complexities, the Retain Return to Work Coordinator facilitates communication between all parties with a focus on getting the employee back to work safely. In late 2018, the United States Department of Labor collaborated with the Employment and Training Administration and Social Security Administration to launch the Retain Demonstration Project. It is led by the Kentucky's Department of Workforce Investment in the Education and Workforce Development Cabinet, and implementation is overseen by the University of Kentucky through new and early intervention strategies to help injured or ill employees stay at work. We recognize that this is a complex situation that needs to be solved in partnership with employers and healthcare partners through training and leadership networks. Retain Kentucky will enable us to build capacity, to provide direct services, and to embed practices that will continue to improve employment outcomes long after the end of Retain. Retain is a research study working with employees, their employers, workforce professionals, and healthcare providers to enhance the success of all parties in the return to work process. We recognize that this is a complex situation that needs to be solved in partnership with employers and healthcare partners through training and leadership networks. Retain Kentucky will enable us to build capacity, to provide direct services, and to embed practices that will continue to improve employment outcomes long after the end of Retain. The Retain Return to Work Coordinator helps the participant identify their stay at work or return to work goals through the development of the Return to Work plan by detailing written steps to expedite that plan. Retain promotes self-advocacy in helping a worker communicate with their healthcare provider, employer, and other workforce professionals in the stay at work and return to work process. All eligible enrolled participants will have support to identify their stay at work and return to work goals and take steps to achieve those goals through the development of an individualized return to work plan. All participants will also receive connections to community resources as needed through the support and early intervention of a return to work coordinator. Enrollment in the study will occur from October 2021 through March 2024. Retain is a free program open to adults who have non-work illnesses, injuries, or impairments that put them at risk of leaving the workforce. Participants will get support from a return to work coordinator to identify their stay at work and return to work goals and take steps to achieve those goals. The individual must be a resident of Kentucky and must currently be employed or have been employed in the past 12 months. The person must have a non-work related illness, injury, or impairment that puts them at risk of leaving the workforce. Conditions such as physical, mental health, cardiovascular, neurological, substance use disorder, or musculoskeletal conditions meet eligibility. Eligible persons have not applied for or are not receiving SSI or SSDI. After having a stroke, Heidi called Retain because she wanted to go back to work in the healthcare industry. In addition to providing other individualized services, the Return to Work Coordinator helped Heidi access benefits through her workplace and insurance company. Due to impaired vision and short-term memory loss after the stroke, the Return to Work coordinator also coordinated services with Heidi's physical therapist and optometrist to help overcome these barriers to return to work. A referral for an assistive technology assessment was made and tools were selected to support Heidi's recovery and functional abilities. Until Heidi's driver's license was restored, she was referred to a community partner for transportation and rideshare services. The Return to Work coordinator guided Heidi in her job search, and she secured a position with another healthcare provider, where she continues to be successful in her role as an occupational health nurse. According to the United States Department of Health and Human Services, social determinants are the conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks, including their ability to work. Social determinants such as transportation can be barriers to return to work. Our Return to Work coordinators can assist in identifying these barriers and help connect the participant with options to resolve these barriers and successfully achieve work goals. At Retain, we have connected participants with community transit services, including door-to-door transport based on medical needs, by supporting the participant in the application process, including submission of medical documentation. Through connections with community partners, we can also assist participants in resolution of other social determinant barriers, including food, shelter, and childcare, so they can successfully return to work in a sustainable manner. For workers who have a goal of returning to the jobs they held at the onset or exacerbation of illness or injury, our Return to Work coordinators provide employment support based on the participants' individual needs. This may include helping identify transitional job duty tasks during the recovery phase when temporary restrictions allow one to return to work, and identifying and helping negotiate job accommodations or modifications. For participants who are looking to change jobs, the Return to Work coordinator can help through career exploration support to learn and discover jobs, the labor market, and how their skills and abilities match those positions. Job-seeking skills training through online application guidance, development of resumes, cover letters, and practice interviews is another way a Return to Work coordinator provides support. The Return to Work coordinator provides job placement and development support by identifying job openings in the labor market as well as hidden job market opportunities. James is a 63-year-old male referred to Retain, Kentucky by his doctor following a stroke that resulted in decreased cognitive, visual, communication, and fine motor abilities. Additionally, James had comorbidities of diabetes and hypertension impacting his ability to work. James worked as an environmental services worker at a hospital for 4 years and wanted Retain's help staying in this role. At the request of the Return to Work coordinator, James' doctor provided written work restrictions that he forwarded to the employer for ongoing accommodations based on James' current functional abilities, resulting in a condensed work shift that met his ability to physically perform the job, given his decreased stamina. The Return to Work coordinator identified a barrier in James' limited use and knowledge of technology and created an email account for James with instruction on how to use this resource as a tool to assist in his memory deficits specific to medical appointments and communication with his employer and healthcare provider. Another way he helped to overcome the technology barrier was by meeting James in person to get his signature for release of information so the Return to Work coordinator could assist in communicating with his therapy providers for scheduling services prescribed by his doctor. The Return to Work coordinator assisted James with social determinant barriers to health, including rent, utilities, and transportation, by contacting nonprofit agencies that help overcome those challenges and connecting them to James. The Return to Work coordinator also helped James to make appointments to see specialists since James was having difficulty remembering to make and keep scheduled appointments. You can scan this QR code and answer the 4 eligibility questions. Potentially eligible individuals can provide contact information, and our intake coordinator will contact you within 1 business day to schedule a meeting. Retain is easy to access by calling 859-562-3251. Email us at retain@uky.edu Visit us at kyretain.org or scan the QR code on our employee screener to leave your contact information for us to call you. Contact us to learn more about how Retain can help you or someone you know. References for this presentation can be found at the site locations listed on this slide. This product was funded by a grant awarded by the U.S. Department of Labor. The product was created by the grantee and does not necessarily reflect the official position of the U.S. Department of Labor. The U.S. Department of Labor makes no guarantees, warranties, or assurances of any kind, express or implied, with respect to such information, including information on linked sites and including, but not limited to, accuracy of the information or its completeness, timeliness, usefulness, adequacy, continued availability, or ownership. This product is copyrighted by the institution that created it.